This is my grandfather, Arlington McClough, also known as Butch, but I called him Poppy. He was a great man to many. He was a great husband of 56 years. He was a father, he was a grandfather, he was a friend, he was a good neighbor, and he was Bible believing. He was not afraid of his faith. He wasn't afraid to share his faith. He has left an everlasting impression on my life, and I will always love him. My grandfather was diagnosed with non-Hodgkin's lymphoma in March of 2016. We found out about Allied Hospice through actually a hospital stay, and we were already involved in the past with their services, so we wanted to continue with the services that Allied had offered in the past through home health, and so we figured that they would be the best fit for us for his hospice care. They knew of his disease. They knew just the certain pains and just the things that kind of came with it. And because they were so knowledgeable, they were able to combat those things. So it was able to keep him very comfortable through the duration of the time that they were involved with us. There was one instance where my grandfather's health was declining, and it was around 12 o'clock at night, and we weren't sure what to do. He had a temperature, things of that nature. And so we called the on-call nurse, which was someone who wasn't ever there at the house with us. She didn't even know how to get to the house, but I gave her step-by-step directions, and she was still there within 15 minutes. So it was wonderful. He wanted to be at home. He wanted to be comfortable. He wanted to feel safe. And he wanted to be surrounded by his family. And us being at home, we had the comfortability to just be ourselves and just surround him with the love that he needed at the time. And the hospice nurses really helped us to facilitate that for him. What I would say to Allied is that, one, I would let them know how grateful and thankful my family is for their help and their support and their genuineness for us and my grandfather. The way that they cared for him, they allowed and really helped to facilitate the way that we needed to grieve, which was in home, which was privately, surrounded by the family. And they were very much a big part of his end-of-life care. I think it was the best choice, and I don't think that we would have chosen anything else besides for him to be at home where he belonged. He was my hero. He was my best friend. I loved him with all my heart. And he was just the best man I ever knew in my life.